I'm here on a beautiful Monday afternoon, a little chilly, in Lakewood, Washington, and I wanted to talk today about a common question that I get is, how do I know if I have sleep apnea, or what should I do if I feel like I'm not sleeping well? What are the steps I go through? So the first thing I'd like to address, take a few seconds to address some of the symptoms that you may have in the evening while you're sleeping, or at night while you're sleeping. And the most common one, of course, is snoring. Snoring is not benign. It is not a sign of good sleep if you're snoring. I know prior to sleep medicine even becoming a thing, so to speak, people would say, oh, I slept so well, I was sawing logs. Well, we now know that that is not normal, it's not healthy, and that is something that if you are a snorer, needs to be addressed. Some of the other things, if you have a bed partner who is elbowing you in the ribs and saying, you stop breathing, or you're not breathing, or you need to start breathing, that is definitely a sign of having poor quality of sleep and having sleep apnea. Feeling very tired during the day. If you don't just hit kind of that mid-afternoon sort of slight slump, but you're sluggish all day, you're chugging coffee to just function. Extreme sleepiness during the day is definitely a sign that your quality of sleep is compromised and that it should be addressed. Some of the health issues that go along with suffering from sleep apnea, cardiovascular disease. So if you've had a stroke, a heart attack, if you suffer from high blood pressure, particularly high blood pressure, if you have a good diet, but you suffer from high blood pressure and your physician's like, well, I don't really know why you have high blood pressure. High cholesterol, chronic pain. Some chronic pains are definitely, if not caused by, made worse by poor quality of sleep. Something that we call metabolic syndrome, which sort of wraps all of this together in a package, the cardiovascular disease, the diabetes, breathing issues, those types of things. If you ever hear a physician tell you that you do suffer from metabolic syndrome, definitely have your physician test you for obstructive sleep apnea. Those are the biggest, I guess, the most common signs of having issues with your sleep and reasons to ask your primary care if you should have a sleep study done. And it's just a matter of calling your primary care physician and telling them that you are concerned about your sleep. And if so, what should you do? Some primary care physicians feel very comfortable ordering a home sleep apnea test. This is a machine that you'll pick up from a sleep lab, and you'll take it home and you'll sleep in your own comfort of your own bed, your own home, and administer the test. Sometimes it's a one-night test, sometimes two, sometimes three, depending on the company that your physician works with as far as the sleep test. And also your physician may just order a couple nights of sleep testing. It is, in my opinion, better to have more than a one-night snapshot of your sleep. So 2 to 3 nights, I really like when I get a 2 or 3 night sleep study from a physician. The other thing that your primary care physician may do is send you to a sleep physician, who is someone who specializes in sleep disorders. And if that's the case, you'll have a face-to-face with a sleep physician, and then they will order either a home sleep test or an in-lab test. Home sleep tests right now are the most common, most popular. One thing to recognize is that home sleep tests will rule sleep apnea in, but not necessarily rule sleep apnea out. So home sleep testing is not as accurate as in-lab testing. So we will usually administer a home sleep test first, but if you do have, are very symptomatic for sleep apnea and that home sleep test comes back normal, then your physician may order an in-lab test to really get what the quality of your sleep is at that point. And again, that is the most accurate type of testing. Once you have the test done, you should get a call either from the sleep physician or your primary care in regards to your results. with an in-lab test, what I should say is an in-lab test is also going to give us the results or the effect of snoring on your sleep, and a home sleep test does not necessarily do that. So if you have a normal sleep test, as far as you don't have any times where you stop breathing or where your airway narrows enough to where your blood oxygen level falls, but you snore loud, and you have these respiratory effort arousals, then an in-lab test will give us that information as well, which then can contribute to your sleep apnea or your diagnosis of sleep apnea. So that's sort of a quick picture of what it looks like to have sleep apnea and the types of symptoms you may have that should hopefully prompt you to ask your primary care physician if that is something you should be concerned about and or tested for. And then once you go through that process, we will be providing videos or live Facebook posts on what to do once you've been diagnosed. But the most important thing is, if you have the concern, talk to your physician about it. You can even talk to your dentist about it. Your dentists are in a position where they can screen for sleep apnea, and we can talk about that in future Facebook Lives as well. But you can even ask your dentist, I'm concerned, I'm tired during the day, I'm not sleeping well, I'm waking up at 2 or 3 o'clock in the morning and I'm not able to fall back to sleep. And, you know, I'm concerned that I'm not sleeping well, and so where should I turn to have this assessed? And again, starting with your primary care physician and a sleep study is definitely the way to go if you have any concerns. Do not let it go undiagnosed, because the problems caused by chronic sleep apnea or sleep disorders in general, because there are many others besides obstructive sleep apnea, but poor quality of sleep, the health concerns caused by that are detrimental and definitely worth getting diagnosed and treated so you have a better quality of life. I look forward to seeing you in future live Facebook page, and thank you very much for watching. If you have any questions, feel free to call Soundbridge Dental Sleep Apnea Therapy at 253-514-6076. Have a great week.